Hi everyone, I'm Steve Main, here with Dr. Nario of Biointegrative Health Center in Reno, Nevada. You can look them up online and see what kind of treatments they do. So today, let's talk about hair, hair loss. So just to start, I would like you to define, how would you define hair loss?
Well, Steve, again, thank you again for having me. So we'll talk about something that's very sensitive, not only to men, but women also. And you heard of the statement, touch everything else except for the hair. And you would hear this a lot from our famous, or remember these famous icons such as Elvis Presley, James Dean, uh, because of the bangs that are hanging out, the hair that's all like brushed up. These are the guys who carried hair real well. And now we also hear about afros, the fluffy hair, braids, hair coloring. These are different styles that you can apply on hair and variations of hair, long, straight, curly, and short. All of these are different descriptions of our hairstyles now. The problem now is when we see strands suddenly shedding off, like money draining out of our bank accounts. That's when we all freak out. This is what we call alopecia, or loss of hair. It's a natural phenomenon. Normally, it occurs during the hair growth cycle, and later on, I'll expound on that. And at birth, we usually have at least 150,000 hair follicles in our head, and estimated the most individuals lose about almost 100 scalp hairs over a 24-hour period. So that's pretty normal. So I hope people don't get scared when they see this on their pillow, in their shower. And hair loss becomes a cosmetic problem when it occurs in the wrong place, at the wrong time, and in the wrong individual. Some statistics for you would be average men, noticeable hair loss usually at 50 years old. When they see that at that age, it's usually probably 50% is gone. And for women, thinning hair and hair loss affects roughly around 1 in 4 women.
Wow. So yeah, I know that, it's something I've researched a little bit, again, probably just enough to be dangerous, but I know that just because you're shedding or hair is coming out does not mean your hair is getting thinner.
Mm-hmm.
So I know there's a cycle.
Yeah,
So talk to us a little bit about the hair growth cycle. I know it comes out, it regrows,
that's right.
just part of the cycle. So can you talk a little bit about that?
Yeah, so Steve, I want everybody to imagine rice crops or grass that we pull out of our lawns. So when you pull it out, there's something that's going to grow from the bottom. And I also want you to imagine there's a root or a source underneath where it's coming from. So there are 4 stages. I'm going to state that I'm going to explain this as easy as I can, so for everybody. So one is the growing phase. Well, in medical term, it's anagen. So this lasts for 2 to 7 years and determines the length of our hair. So whatever hair you have right now is actually, this is the growing phase. It's still growing. And why is it growing? Because it's still connected to the blood supply underneath, which is what we call the papilla in medical. Yeah, we're using medical terms. And that's why it's still continuing to grow. So that's majority of the hair. Now we go into what we call the transition phase. Medical terms, catagen. This lasts about almost 10 days, and the hair follicle shrinks and starts to detach from the blood supply. So they're getting separated now. So before they were like this, and now the hair is like that. And then the other one is the next stage is resting phase, which is telogen. This lasts around 3 months, and around 10 to 15 of our hair are in this phase. While the old hair is resting, a new hair begins to grow underneath that so-called blood supply. But you have to remember there's now complete detachment of the hair, of the old hair, but there's a new one that's growing underneath. So that's the resting phase. And last one would be the new hair phase, or what we call the exogen, wherein old hair now sheds off and the new hair underneath continues to grow out. And approximately 50 to 150 hairs can fall out, again, as I mentioned, daily. And this is considered to be the normal hair shedding. So again, I want you to imagine the connection. So as you can see, it's just moving out, 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 and then a new bud is coming from the bottom.
Okay, so what causes hair loss? Because what messes up this cycle? What causes people to lose their hair?
Well, Steve, that's going to be a very long discussion. The plain answer is many, but I will discuss today the most common that I see clinically, especially in my practice. One is what we call anagen effluvium. Forget about that term. I'm going to explain to you an easier way to remember that. It occurs secondary to an acute injury of the hair follicle by an agent. May it be an agent from inside the body or outside the body. This is usually an example. Maybe an easier way to understand this is chemotherapy, medications, or even radiation. And worse, this is the worst case, but mild case would be using hair dye that damage the hair shafts and removing the hair through these chemicals. But the concept here is when you're on chemotherapy, let's say, there's diffuse hair shedding. Eyebrows comes off, eyelashes, axillary hair, pubic hair, they all go away. And the damage is ongoing here. Well, the hair is still on the growth cycle. So, but here's the good thing about this type is once chemo's done, hair grows back. Here's the weird part though. I have cancer patients who says, I started with straight hair. Now they're growing as curly. Again, I tried to see the literature for this, but there's no explanation why this happens. Another one is telogen effluvium, which is temporary hair loss. And this is the one that we usually see when we encounter stress. Holiday shopping, preparing for guests. It's always an immediate shock or a traumatic event that snaps and disrupts the hair cycle for us. And we actually have these stress, and we might be thinking that, oh, because I'm pulling my hair a lot when I encounter these stressful events. It's not really, but it's your own body that's doing it for you. It pushes the hair into what we call the resting phase. So suddenly just puts it aside. And you would notice this type of hair loss as uniform. It's all over the scalp. It's not like patchy. And it can appear even 2 to 4 months after the stress. So don't think that, oh, the stress is gone, I'm still losing hair. It's probably not the stress. It can still happen because it has long-term effects. But not only can we blame stress for this, but we can also blame our own body in terms of the changes like hormonal changes such as menopause and low thyroid hormones. And here's a good fun things to play with your friends and family. When you see the size of the eyebrow when it's falling out, most of the time this is because of low thyroid hormones. See, you can now help out people out there and be a little do some little doctoring yourself. And lastly, the most famous one is androgenetic, which is genetic. This is common, genetically based, commonly seen in men and women. And men, this is now what we call the male pattern baldness. Hair loss is well defined, beginning above the temples, and you would see the receding hairline and forming the M shape. And you would see this a lot in older men. And hair thins at the crown, which is near the top of the head, often progressing to partial or complete baldness. This happens in women too, but the pattern is different. In women, the hair becomes just thinner all over the head, and the hairline does not recede. Now, androgenetic risks in women are rarely leads to baldness, complete baldness. And when I mentioned to you a while ago, we had a discussion about high testosterone can actually aggravate this. But I have to make mention, it's the more active form of testosterone, which is the dihydrotestosterone, which is going to be converted from plain testosterone. Because of this DHC, it actually attacks your follicles that are sensitive, thus leading to follicle disintegration.
Okay, so how about, can we talk about some myths about hair loss? Like I know wearing a hat, that's a myth, right? That doesn't make your hair fall out. See, I know one, right? Am I right?
There you go. That's
So,
another one.
okay, what are some common myths about hair loss?
All right, Steve. So this is probably everybody can relate to this specific question. We probably heard it from our grandma, read it from a magazine or from the internet. Now let's debunk these hair myths, as we call it. So shampooing too much. People would say that, ah, yeah, it's gonna make me lose more hair. But the thing there, it's really not the shampoo that does it. It's really more for when you use a strong shampoo, meaning lots of chemicals, lots of ingredients. That's why I would promote use organic with low preservatives type of shampoos. That can definitely damage your hair. But the thing here, shampooing is really actually good because you massage the scalp and it increases the circulation to the hair follicles. And another important thing here is if you have excessive dihydrotestosterone that's making you lose hair, you actually remove the hormone when you use shampoo off of the hair follicles and wash it off with water, thus decreasing the DHT content of the hair follicle, preserving the hair. So that's number one. Number two, shaving hair produces a thicker hair when it grows back. I don't know if you heard of this, but this is out there. The deal breaker here is only gives you an illusion that it's thicker due to the bottom of the hair having a larger diameter. So you're actually just cutting the thin tip out. Thus you have the thicker end. And when you look at it, like, wow, I have like thicker hair now. So it's just an illusion. No truth to this. Another one would be brushing your hair 100 strokes will make hair healthier. I don't know if you heard of this, but the women probably would be more knowledgeable about this. Well, unless you're really massaging your scalp while you were combing your hair, this will increase circulation and, of course, will be good for the follicles. The only good that it does, it only spreads the hair oils from from different parts of your hair to all over it, to all over the surface area, thus making it shiny, thus people thinking, wow, healthier hair. But it's just you spreaded the oil. And some gender myths, hair loss, they said only for the intellectual women. So women, don't try to lose your hair for that math exam they're trying to prepare for. And another one is hair loss only for men who are virile or strong. So people in the gym, be happy to hear that. But again, these are not true and all, I don't know what the bases are, but not medically backed up.
Okay, so what about treatments? Is there any treatments that work, or any treatments that maybe you do at the clinic, or something that you can recommend to try that maybe will give you a chance?
Oh yeah, there's a lot. So let's talk about first the common conventional approaches of hair loss, Steve. The number one that you would hear, because sometimes I see this in over the counter also, like I don't know if it's over the counter, but minoxidil. So it's actually made for hypertension control. But the reason for that is it has the ability to vasodilate blood flow to the scalp, so that increasing blood flow promotes hair growth. And this is also found in cream form. Another one is finasteride, which is what they call it 5-alpha reductase inhibitor medicine. It actually prevents the conversion of testosterone to dihydrotestosterone, which I told you, which is harmful for the hair follicles. And this can be orally taken in, but side effects. This is the one that I want to caution patients about, because when you have the side effect to this is lowering libido, lowering energy, that's going to be counterproductive. You do have fluffy hair, but you don't have energy. That's not good. Spironolactone, another one, is actually diuretic, and it's also a treatment for blood pressure. This is another dihydrotestosterone blocker, meaning it doesn't let the dihydrotestosterone attach to that receptor. It's in the form of oral and also in cream form. But the thing here is we promote more of the integrative medicine type of approach, meaning we need to address the real cause for hair loss for it to be effective. So which are the options? Number one, more famous is Biotin, which is vitamin B7. It's in the form of oral or topical, and this is actually used for hair, skin, and nails, and not only for hair. Problem here is now the world, the food that we eat is deficient of vitamin Bs in general, including B7. Another one is melatonin. Melatonin, as we all know, is known for sleep induction and sleep promotion, but it also helps with hair growth. It's an antioxidant, and as we know that the studies that we've seen supports the extension of the growth phase of hair. But again, if you're not sleeping, of course, you're losing hair, more stress for you. And the heart of the matter and what we do is the root cause medicine approach, meaning targeting the real cause of the problem. Most common problems for hair loss would be thyroid problems and hormonal imbalance. So women who are in menopause usually experiences hair loss. The whole hair cycle actually lasts 3 to 4 months, all those 4 stages that I mentioned a while ago. That's why I want to tell everybody, when there is a treatment for hair, it takes this much time to assess the effects of these specific treatments. These are not quick fixes. In this discussion or this video, we will not cover the new hair loss therapy approaches such as lasers, PRP, stem cells, and hair transplants, which actually produces quicker hair results that people want to. But again, this is more of the natural approaches that we have discussed today.
Okay, very interesting. Well, we thank you, Doctor. Dr. Nario, Biointegrative Health Center in Reno, Nevada. Check them out online. You can see all the different treatments they do. So thank you, Doctor.
Well, thank you, Steve. Thank you for having me again. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.